So thanks for being here, everyone, to our brief BUP training, or our 10-minute waiver training. Part of the reason this training came about is because, as many of you may know, and as Dr. Walker will talk about in more detail, there have been some changes to the buprenorphine waiver process, mostly eradicating the requirement for training if you plan to treat under 30 patients. So what Dr. Walker will do and assist you all with is completing your notice of intent to prescribe forms. And if you have the time to stay on for the additional 50 minutes, we're going to talk a bit about buprenorphine induction and medications for opioid use disorder in general, and then we'll take some questions as well. So without further ado, because I know we're going to need every minute of this time, I want to introduce Dr. Walker, and I'll let her say a bit about herself as well. Dr. Walker is the Director of Substance Use Disorder Services at My Health, My Resources of Tarrant County. She's also one of our subject matter experts in our TexRx ECHO program, for those of you that may join that program, and we'll talk a bit about that later and some other resources that we'll make available to you all after the training. But without further ado, I'll turn it over to Dr. Walker to introduce herself, and then we'll jump into the training.
Thank you so much, Dr. Lindsay. I appreciate it. Okay, so let's get in. Now, there are two items in the chat. One is the URL, of course, to get to the notification of intent website. It's also on the top of this slide. If you're having difficulty with the URL, you're able to look at it. And it should have also been in all of the notification emails that you received for this training as well. We wanted to make sure everyone had really easy access to it. Okay, so a little bit about me. I am a physician assistant and physician associate by training. That is still how I see patients, but I do have my doctorate. So when I'm in educational settings, I'm typically Dr. Walker to my students, and to my patients, PA Walker, and to my friends, Crystal. You're welcome to call me any of the above. I spent about almost a decade working in the Tarrant County Jail, in a jail setting. That's where I was first exposed to individuals with substance use issues. And then I transitioned into treating homeless and indigent individuals through John Peter Smith JPS Hospital at their homeless clinic. And then from there, for the last 7 or 8 years, I have been involved with a very specific substance use treatment setting where we have all levels of treatment that you can imagine, from inpatient detoxification to intensive residential to outpatient to partial hospitalization programs, and I am the director of those services. So I'm very familiar with the treatment of substance use disorders, and hopefully can help you walk through this. And the first 10 minutes are going to be dedicated to getting you registered, because we know some of your time is very precious and you only have a small amount of time. So we're going to do that first. And then afterwards, we'll go over some education around substance use disorders and what our current state in the United States is involving opiate use disorder. So if you would like to stay around and earn an hour of CME credit, we will have a little didactic after signing you guys up. So hopefully I've chatted enough to give you guys some time to access the website and to gather a couple of items. I put this in the chat, but if you didn't see it, you will need your DEA number and your state medical license number. Now, the one thing that you don't necessarily have to have is your training certificate for buprenorphine waiver training. So if you have it, great. If you don't, absolutely fine. We can still proceed even with that. Now, if you are a PA or a nurse practitioner or any other type of APP that requires a collaborating or supervising physician, you will also need to have that physician's name, their DEA number, as well as a contact phone number for them. So hopefully you have a chance to gather that information. If you don't have all of that information easily accessible, that's okay. Go ahead and watch and follow along so that you know exactly what you need to do once you do have that information to sign up for this. So this first page, you may have a question that asks if you work for the U.S. military, the VA, or the Indian Health Services. Answer that appropriately for yourself. And then your next screen that you're going to come to will be your information. And this system is great because it's going to automatically decide or look up what your eligibility is. So you can put your licensing state. Most of you are probably Texas. And of course, you need to select what your level of practitioner is above that, your state medical license number, and then your DEA number. Now, something about an X-Waiver number. Some individuals will have more than one DEA number. They may have multiple DEA numbers depending on multiple practice locations. You will need to choose one. Choose your main one, and you can always go back and add additional ones to it. You will only ever have one X-Waiver number or buprenorphine waiver number. So your main number is what you need to choose here, but you can always go back and add more DEA numbers to your profile later. Okay, so then your next screen, this is going to be a very, very important question to pay attention to, because what you choose here is going to automatically choose several options on the next page. And the only way to change those options will to be backing up and coming back here to change what you select here. So make sure and pay attention and choose the appropriate item the first time so you don't have to backtrack a lot. So first of all, what it's asking is, are you a board certified in addiction medicine or addiction psychiatry? If you are, of course, choose yes. If you are not, then choose no. Then the second question is, do you provide medicated assisted treatment with covered medication in a qualified practice setting? Now, if you, the next screen is going to go over what a qualified practice setting is. If you don't know, choose no. Unless you're 100% certain, go ahead and choose no. Choosing no on both of these questions is going to set you up with what's called a level 30 waiver, meaning it's the entry level waiver. You're able to treat up to 30 patients at one time, and you can always move up. But if you accidentally check the wrong button, you can't, you have to go through a big long process with the DEA and SAMHSA to get that corrected. So choosing no is probably what the majority of you guys are going to do. So to briefly go over what a qualified practice setting is, it's all of these criteria. So it essentially, what this applies to the majority of the time is somewhere like where I work, which is dedicated to the treatment of substance use disorder. We have an actual dedicated substance use clinic that is certified by the government and the DEA as a substance use treatment facility. And so here are all of the criteria for that. If you meet that, awesome. If you meet it and you check yes, that means you're automatically approved for a 100 level waiver. But again, if you don't know, go with no, just to be on the safe side. So if you checked no on both of them, then another screen is going to pop up, or a little extra question is going to pop up. And it's, I wish to apply for the 30 level with training or the 30 level with exemption. So if you have not taken the 8-hour waiver training course as an MD or a DO, or the 8 plus 16-hour waiver training courses for all of the APPs, then you're going to want to click exemption. Exemption means you do not have those training certificates and you are not going to submit those training certificates. So go ahead and put exemption unless you have those certificates. If you have them, you just can't find them, that's actually really easy as well. Go ahead and click exemption so that you can finish the form so you don't have to find it and submit it. And I will show you how to submit it later in just a couple of slides. Okay, the next thing that you're going to do is fill out all of your information, your first name, your last name, your professional license number may auto-populate. If it doesn't, that's okay. And then, of course, you need to fill out your professional discipline and all of the other fields in section 1. Now, the next section, sections 2 through 5, what you typically want to do is put the address that is on your DEA license that you're using. If you have multiple practice addresses, that's okay. You can go back and add them to your profile later. If you need to add additional locations that you're going to be using your X-Waiver at. The most important thing on this page, however, is your email address. Use an email address that you know isn't going to block an email, send the email to spam, prevent it from coming through, because that is the primary way that SAMHSA is going to correspond with you regarding your registration. That's how they're going to tell you that they received it. That's how they're going to ask you if you have additional training certificates. They're even going to send you your letter saying that you're waivered through email only, not snail mail. So make sure you choose a good email for this section. Now, your next section, number 6, is going to be grayed out and auto-selected. So as you can see here, if you selected no on both of those initial questions, it'll be grayed out and it'll say new notification to treat up to 30 patients. You do have an option to check the box that says with intent to immediately facilitate the treatment of one individual. So if you need to write a prescription for buprenorphine today, and that's why you're here, because there's an emergency and you need to know how to get this and prescribe for someone today, check that box. That allows you one single emergency prescription for one individual. Okay. So if you need more than one for one individual, you'll have to submit multiple emergency treatment requests through this same form. But again, that allows you for one person if you need it right now. Otherwise, if you don't need that emergency, just leave it blank. You're good to go. It's already grayed out. Everything is wonderful. Okay, so sorry, this screenshot's a little on the blurry side, but number 7, you may or may not see, and it's just saying that what you're going to do is only prescribe a scheduled 3, 4, or 5 drug that is approved by the FDA for the treatment of maintenance or detoxification for opiate use disorder, which essentially means buprenorphine. AKA Suboxone, because that is the current only FDA approved medication that is a scheduled 3, 4, or 5. This does not cover scheduled 2 medications, including methadone. So this does not allow you to write for methadone, but it does allow you to write for bup. And this is just acknowledging that you understand that. And if you just listen to my spiel, you should understand it and check yes. Okay, number 8. This is going to look a little bit different for everyone depending on what you have checked. So it may auto check that you are applying for the exemption to treat 30 patients. If that's all you're doing, that's wonderful. That's all you have to check. Now, if you're board certified, you'll see a lot of other options that you can check if you're board certified to prove how you have those certifications. If you checked that you have your training certificate, it's going to ask you for that information, where you got your training, to upload the certificate, and questions like that. So depending on what you checked, you may or may not see some of these items, and that's okay. So here is one example of how it looks. Here's another example of how it looks. Like I said, it may look different for some people. So hopefully it's automatically checked. Now for APP specifically, you're going to have to additionally check that you are either a nurse practitioner or a physician assistant who satisfies the definition of being qualified under the CARA Act, which we will go over a little bit later. So you'll have to check that box saying that you are a certified PA or advanced nurse practitioner, and then also that you are licensed, that your DEA license covers you to prescribe scheduled 3, 4, or 5 medications, and you'll need to check that box as well. So pay attention to those depending on what your degree is, and check what is appropriate to you. If you are an APP, this is the section where you will also need to put your supervisory or collaborating physician's name, their phone number, and their DEA number. So you'll be able to pop that in there. Now, the next thing is certifying capacity, which means you have the ability to treat somebody with opiate use disorder. And this is pretty standard. It's just saying that you can and you will accept and treat individuals with opiate use disorder. That should be really easy for you to check off on. And then the next one is going to be certifying your maximum patient load. Again, depending on what your screen is and what your qualifications are, these may look slightly different. So some individuals, 9 may just be certifying you have the capacity, while some of them may say that you are not going to exceed 30 patients. Now, if you do end up getting your training and it has been more than a year, then you can actually come back to this form and do what's called a second notification, where you can raise your level from a 30 to 100. So that is one way that you can get a little bit more patience, even if you don't have the certification right now. And again, I'll explain that a little bit more later, but right now we're just doing the first notification for most of you guys. So you'll certify that you're not going to go over 30 patients. And this means 30 patients at one time. So you can have 30 active prescriptions. And as soon as one prescription ends, so if you write 30-day prescriptions on October 1st, on November 1st, you now can write for 30 new people if you need to, if that is something you want to do. So it is active prescriptions at one time, not in the course of a month or in the course of a year or anything like that. So it can be significantly more than what some people initially think when you hear only 30 patients. All right. And then the last section is your consent to get published on the SAMHSA website. So there is something called the Buprenorphine locator on the SAMHSA website, where other treatment facilities, hospitals, centers can look up a location and see if there are any treatment providers available in that location. If you are agreeable to having that information published, then you hit consent. And then you can indicate what you are willing to treat and what not. Now, I don't know if this is still on there or not, but number 3, which is the long-acting implantable buprenorphine, it has actually since been taken off the market. But you could be providing injectable naltrexone, aka Vivitrol, or injectable buprenorphine, aka Sublocade. And if you are, check it. If you're not, you don't have to check it, or check no. Okay, and then the very last thing is going to be typing and signing your notification of intent by typing your name and then re-entering your DEA number and then hitting submit. And you should get a little signal saying that your notification has been successfully submitted and everything is good to go. Now, you might receive an email later. This is an example of an email that was received recently that is essentially asking for clarification from the SAMHSA team. And they are requesting, hey, if you completed the training, let us know. If you didn't complete the training, no big deal whatsoever. Just let us know and we'll give you the 30 exemption or the 30E license. So you might receive an email requesting further clarification, and that is to be expected and pretty common as well, especially because of how confusing this form is. And every person that fills it out has a little bit different wording of each question. So that confirmation in that email is just a really nice way to clarify through SAMHSA. So that was our quick run through of it. I went a little over the 10 minutes because I explained a little more thoroughly than normally. So I will take a couple of minutes to answer any questions if you guys have had any trouble with filling it out. It looks like there was a question in the chat. What about 2A? Is this practice location a federally qualified health center, an Fqhc? So if that is a check box and you work at an Fqhc, then yes, check that. Especially if that is the DEA number that you are using and registered under. Does anybody else have any questions? Did you run into any problems registering?
Is this a registration you have to do annually, Dr. Walker?
No, it is a one-time only. You fill it out, and what will happen is you will actually receive a new DEA license. So the DEA number that you're submitting, you are going to receive a DEA license that has your DEA number. Let's say your DEA number is in MW123456. You will receive one that says MW123456 and XW123456. That's why they call it an X number, because they just changed the first letter of your DEA number, and that's now your X number. So you'll receive a full new license, and you don't ever have to fill this out again unless you want to move to the next level. So if you want to increase from 30 to 100, or even from 100 to 275, if you're in one of those special practice areas, then you can then go in and resubmit this form to move up to the next level. And the cool thing about it is SAMHSA tracks all of it. So if you haven't waited the full year, or you don't have your training certificate submitted, and you go in and you're like, oh, you know what, I want to go up to 100. You log in, it'll prompt you that you're not eligible yet. They'll be like, nope, you need to wait until September 28, 2023 to resubmit for the 100 level. So it's really nice and sometimes user friendly on some of the things. Okay, then we're going to go ahead and jump into.
I have a
Oh,
question.
yes.
Yeah. So number one, my form is not going through for submission. And my second question is that I own a MAT program, medication assisted program, and we do buprenorphine, Vivitrol, and methadone. But I don't know if I'm allowed to prescribe buprenorphine, being that I own it.
Oh, as long as you are a qualified practitioner that meets, you have your medical license number, you have your DEA number, and you have your X-Waiver number, then you should be able to prescribe it, because there are many providers who own and practice in a location. So I don't see where that would be a conflict, but I have never had that question asked to me before. So as long as you meet all of the qualifications, I don't see where that would be a problem. I am happy to try to discuss offline after this. I will stay about 15 minutes after we're done to kind of talk through some of the things. We'll stop the recording and we can just have a chat afterwards, maybe. Okay. All
Okay.
right.
So, but my form is not going through. Am I supposed to upload something?
I am uncertain about that because I cannot see your screen, but it should, once you hit submit, if you are missing something, scroll back up through, and if anything's highlighted in red, you may have accidentally missed a checkbox. You may have accidentally not put in or filled in something in the form. So scroll back up through to make sure you didn't miss anything if it's not submitting. Okay.
I checked, but okay, I'll wait for I'll keep checking while you're doing others.
Okay. All right.
Hello, Dr. Walker.
Hello.
Can you hear me?
Yes, I can
Hi,
hear
this
you.
is Christy. I just need to understand, if I have a DEA that is good for 3 years, does this X-Waiver go with it for 3 years, or how does it work?
I am not certain I understand your question. So you're asking if you've had a DEA number for a number of years, if you
Yes.
okay. So yes, if you've had your DEA number and your X number are two different items. So I will give you an example. If you are going to write for a transdermal buprenorphine patch, aka a Butrans patch for pain, you would use your DEA license number because it is for pain. It is not for the treatment of opiate use disorder. If you are going to write for buprenorphine sublingual, aka Suboxone, for the treatment of an opiate use disorder, you will need to use an X number. And so I think if you guys will let me go through this next part, I may actually be able to answer some of these questions that you're having. So let's jump into it. And then if there are any other questions, like I said, I will stay a couple of minutes late to help you guys through it.
Dr.
So
Walker, can I just pose one quick question that came in privately in the chat from a nurse practitioner? If someone wants to apply for the 100 patient waiver and their nurse practitioner or PA, they will need to do the 24-hour training, correct?
100% yes, that is
Okay,
correct.
thank you.
That is correct. Thank you for clarifying that. Okay, so let's talk about history for just a little bit. So since 1914, when the Harrison's Narcotic Tax Act came out, our federal government decided to separate substance use disorder treatment from treatment of any other disorder. In fact, it wasn't until the 1980s that DSM-5 or the DSM came out, I think it was DSM-3 actually, that came out and actually declared that substance use was its own disease disorder and its own diagnosis. So it is siloed, it's separated from the rest of medicine. And because of this, the Controlled Substance Act that came out in the 70s essentially said, if you are a prescriber, if you are a physician, you are not legally allowed to write for a narcotic for someone with a narcotic abuse issue or a substance use issue. So this is why we can't write for controlled substances for the treatment of a substance use disorder without special licensure. So one of those special licensures is an OTP or an opiate treatment program, otherwise known as a methadone maintenance program or a MAP program. And that has to be federally licensed and federally regulated. And then in 2000, the Data 2000 Act came out. This is where the X number or the X-Waiver or the data waiver came from. And so what this act, this piece of legislation states is that if you are a qualified provider, prescriber, physician that takes an 8-hour course and then registers with the DEA stating you're intending to do this, and you limit it to only those medications that are FDA approved, then you can prescribe to somebody with a substance use disorder a scheduled medication. So that's a lot of qualifiers. And the only thing currently that meets those qualifiers is buprenorphine. But the way the legislation is worded is any other formulations, as long as they're scheduled 3, 4, or 5, and they're FDA approved for the treatment of a substance use disorder, this X-Waiver should cover it if future medications come out. So that is the whole purpose of having to do this waiver, is because 100 years ago, they decided to separate out the treatment of substance use disorders. So that's why you need special licenses to treat opiate use disorder, but not pain, even if you're using the same medication. And then in 2016, they decided to expand with the CARA Act and state, okay, APPs can now do it as well as physicians, but an APP not only needs the 8 hours that the physicians need from the Data 2000 Act, they need an additional 16 hours. Then finally, in April 2021, they realized what an issue we were having with opiate use disorder in our country and all of the deaths from opioids, that they said, you know what, getting that 8-hour or that 8 and 16-hour is such a burden. We're going to make an exemption. So if you just have an entry-level license to treat 30 patients, you don't have to have the training. But if you ever want to go up to 100 or 275, you will need that training. And you have to have a year at that level in order to go up. So for example, if you get this exemption waiver for 30 patients, and then a year from now you get the training and submit it, you're unfortunately not able to automatically go up to 100. You actually have to practice for a year under a non-exemption license before you can move up to the 100 level. So the exemption license doesn't count toward any time frame requirements that you need to move up to the next level. So it's a great way to get started and dip your toes into it. But just be aware that you need both the training and a year under a normal non-exempt waiver before you can move up to the next level. This is just going over what I just said verbally about the Data Act. And again, with or without training, you can do a notification of intent. With it, you can go up to 100. And then if you have a special license or you're in one of those qualified practice settings, you can actually move up to 275 patients. Now, someone did mention the Fqhcs. There are actually a lot of Fqhcs that might qualify as a qualified practice setting if you read through those qualifications. So it doesn't have to be a substance use setting. As long as it meets those qualifications, you might be able to actually automatically go up to 100 without waiting that year. So we don't have enough time today to like pinpoint and go over each one of those line items, but I definitely encourage you to read about it on your own to see if your own practice qualifies. Now, as far as the DEA is concerned, what the DEA is going to look for if they ever do an inspection is they want to know, are you putting your X number on medications that are for opiate use disorder and written for the treatment of addiction or substance use disorder? And are you leaving your X number off of the medications that are for pain or other items? So you really need to be cautious about what diagnosis you're attaching to the prescription. If you're attaching it to a pain management prescription, you do not want your X-Waiver on it. If you're attaching it to substance use disorder, you want your X-Waiver number on it. Okay, so why are we prescribing buprenorphine and other medications for opiate use disorder? It's because we've found out that your old school traditional abstinence only treatment is unbelievably deadly. So individuals have massively increased mortality rates when they receive no treatment or they try abstinence only treatment. So writing these medications for individuals who are struggling is literally saving lives. And this is a combination of 3 big research projects that show how you are actually saving a life with every single prescription that you write for substance use disorder when you're prescribing buprenorphine. Another thing that I do like to point out, because there's a lot of stigma still surrounding the treatment of substance use disorders, is that it's a journey. It's a journey just like any other medical condition. You don't expect somebody with diabetes to never, ever eat another cupcake or drink a glass of sweet tea or have an elevated blood sugar or need adjusting their medications. Individuals are human beings with free will that occasionally get stressed out and may not have the best coping skills. So they turn to what they know, and it can be really hard to get out of those habits. So it can be challenging for some prescribers to realize that even if they're prescribing buprenorphine, an individual may still use occasionally, and there's various reasons why. But these studies show that after a year of treatment, there is a dramatic decrease in how much people are using and how many of those individuals stay in treatment and stay alive, which is the main goal of this treatment. Okay, so how do you decide when to prescribe or when to start buprenorphine? So first of all, we use DSM-5 criteria to make a diagnosis of moderate to severe opiate use disorder. That's typically the standard. Once they are diagnosed, and remember, if you're not familiar, DSM-5 is for the last 12 months. So if you have somebody who was using 30 pills of hydrocodone every single day, and then they got arrested and they were in jail for 3 months, and then they get out, they don't necessarily have to detox off of the hydrocodone, but they're still diagnosed with a moderate to severe opiate use disorder. Even though they haven't used in 3 months, it meets that 12-month criteria. And it is okay to put that vulnerable population onto medications, onto buprenorphine. And you have the support of DSM-5 to do that. Now, when do you give your first dose? You can use something called a clinical opiate withdrawal scale, or a COWS scale. And this uses both objective and subjective items to determine when somebody is in mild to moderate withdrawal. Buprenorphine is only a partial opiate. So if you give somebody a partial opiate that has a brain and receptors full of a full agonist, the partial opiate's going to win because it has a higher affinity, and it's going to immediately put that patient into what's called precipitated withdrawals. So we really want to make sure that most, or at least a good bit of their full opiate is out of their system before they take their first dose. And this is a great way to do that, is by using this scale. Now, some people use a scale of 8 to initiate it. Some people use a scale of 13, but somewhere between 8 and 13 is a good place where they can start using that. This goes over a little chart that kind of shows, if you have a full agonist, what the graph would look like, what the receptor activation would look like. And as you can tell with the partial agonist, the buprenorphine, it's significantly lower. So imagine if somebody had just taken 10 hydrocodone an hour ago and the receptors are full. If you give them buprenorphine, it's going to take them from that top line all the way down to that bottom line within a matter of minutes, typically 30 minutes or so. They're going to feel like they've been hit by a Mack truck, instead of naturally allowing them to come off of the opiate over the course of 6 to 12 hours. It's much more gentler to let them naturally come off of it instead of forcing them off of it with a dose of the buprenorphine. And that's where the COWS scale is important. So a general way to do it, use the COWS scale. Once they're around between 8 and 13, give them a small dose, maybe 4 milligrams of buprenorphine. Wait an hour or two. If they're doing good, give them another 2 to 4 milligrams of buprenorphine. And you do that until their withdrawal symptoms are managed, or until they hit a max number. Many prescribers use 16 milligrams as their max number. And so day one is just kind of adjusting it based on the patient's needs. And then day two, hopefully your clinic, a nurse or someone in the clinic is able to give them a call, see how they're doing, and then carry on with whatever dose they completed on day 1. So if they made it up to 8 milligrams on day 2, they just start off with 8 milligrams. They don't have to do 2, 2, 2, 2, 2. They can just go ahead and take the full 8 milligrams. Because day 1 is really about easing them onto it and managing their withdrawal symptoms. So what dose is an appropriate dose for somebody? It can depend on how the patient reacts, but all of the literature essentially points to 16 milligrams as being the target dose. And these are multiple studies ranging from 2014 to 2020, and one that was even published back in 1998 when they were trying to decide how to prescribe buprenorphine for that Data 2000 Act. So what they figured out is they looked at 3 different things. They looked at how many individuals were actually staying in treatment, how many individuals were reporting cravings, reporting the urge to use, and how many individuals were actually able to have urine drug screens that were completely negative. So what's interesting is that with the cravings, anything above 4 milligrams really helped with cravings. But even if they reported craving reduction, you can see on the bar graph that it was pretty much a linear correlation with how many urine drug screens were negative, directly related to how many milligrams they were on. So the higher the milligram, the less likely they were to seek a full opioid agonist. So 16 milligrams is one of the reasons why that is a target dose, is because we want all 3 of these things to be good. We want them to stay in treatment. We don't want them to have cravings, and we don't want them to use any illicit opioids. And with that being the goal, that's why 16 milligrams is typically recommended. Now, if there are a lot of resources out there, if you feel like you are becoming overwhelmed and there are a ton of people requesting to be treated and you're not able to manage them, or you need a referral service, Be Well Texas Clinic can be a fully online virtual clinic resource no matter where you are in the state of Texas. So I wanted to provide that information, even though they're based in San Antonio. It is a wonderful resource for you if you start prescribing and you find yourself needing to refer patients to another provider resource. Also, PCSSnow.org is a wonderful free website for all of you that contains numerous items, one of which is free X-Waiver training. So if you want to go up to that 100, go ahead, log on. It's self-paced, free online modules, and you get CMEs. You get continuing educations for all of it. So if you just need 8 hours of CME or 24 hours of CME, this is a great way to do it. And you already have your training certificate to submit to SAMHSA and have a non-restricted X-Waiver license. And then there's also a discussion board. Like if you have a question on, okay, why is naloxone in buprenorphine? Why is that even formulated that way? This forum that's on PCSSnow.org has a lot of experts who have already gone through similar discussions and answered similar questions. So sometimes you can search through that forum and find maybe what you're looking for. And then the last thing I want to mention is the mentoring. You can sign up for a mentor that can help walk you through maybe your first prescription, how to write it, where to access resources. And I am a mentor on there. And so if that is of interest to you, please look for the resources on PCSSnow.org. It's been around for a while and it has really good stuff. So that ends my portion. I am going to turn it over to Dr. Lindsay because she has some other really great resources that I fully support and involved with some of them. So I'm going to let her talk about that. And then I will stay on afterwards to have any further discussion. So take it away.
Great, thank you. If you wouldn't mind just advancing, thank you. And I know a couple questions came into the chat, so we'll be sure to save a little time to answer those. And to Joda's question, yes, you will absolutely get a copy of the slides. We'll also send around the recording. So if we were going through the forms a little fast for you, got stuck somewhere, you'll be able to access that again. But mostly we just recognize that, you know, an hour, of course, doesn't necessarily fully prepare you to prescribe medications for opioid use disorder. And so we want to make you aware of a number of free resources available to you so you can continue to get training and mentoring and all of those good things. So just this last year, we launched the Center for Substance Use Training and Telementoring, or CSTAT. Before we wrap up, we'll put that link in the chat as well. And there's kind of a whole host of things available to you. I'll talk mostly about our ECHO programs in just a minute, or Project ECHO, if you're familiar with that. But we can also provide technical assistance, and we have an annual conference and a number of other resources. If you wouldn't mind advancing, Dr. Walker. So just a little bit about ECHO. If you're not familiar with it, it is essentially an online learning community. It started out of University of New Mexico, and here at UT Health in San Antonio, we're an ECHO super hub with some other UT Health partners. And essentially, it's a learning community that meets entirely virtually. We meet via Zoom. We often meet over the lunch hour. If you're in another time zone, though, I realize that might be different for you. But what you're exposed to is didactic learning and brief presentations, as well as case-based learning. So each session, a learner can bring a case, any case that you're sort of stuck with and stuck on rather, and get some consultation from our hub of experts, and get some consultation and recommendations from the larger learning community. So if you wouldn't mind advancing, Dr. Walker, I'll talk about some of the programs that we have. We have 6 programs. Here are 3 of them. Harm reduction. Hopefully everyone is familiar with that concept of just generally reducing harm for people who use substances, even if they're maybe not ready to enter treatment. We have a public safety facing ECHO, which would be more for those of you, say, working in emergency medicine. We have our TexRx ECHO program, which Dr. Walker serves on our hub of experts. That program is pretty narrowly focused around medications for substance use disorder, but not just opioid use disorder, also stimulant use disorder and alcohol use disorder. And we also have a hospital facing program. So if you're prescribing these medications in a hospital setting or some other kind of acute care setting, we have our recovery support services ECHO, so that's utilizing peers. And then we have our systems and sustainability ECHO program, which is more around, you know, I'm having some implementation challenges. I want some guidance on larger organizational things. So those are all available for free. As I mentioned, I'll drop the link in the chat in just a moment. You can register for any of those programs. You can also get free CE. So we try to make that available with all the programs. And then we have our annual conference coming up in March. This year we are in San Antonio. So we'll share those links in just a moment. But as I mentioned, I want to make sure that we save time for questions. And Dr. Walker, there's some comments that I think you can see, but I also received one over private chat. So maybe we can jump to some of these.
Yeah, absolutely. So
someone had asked, sorry, go ahead. I'm talking over you.
It's fine. I was going to go ahead and address Amy's question.
Yeah, that's great.
On, how is she able to tell how many patients her provider in her facility is already signed up to treat? Go to the link where we went through the form, and the moment you put in the license number and the DEA number, it'll actually pop up a screen that says you are eligible for, and it'll tell you what you're eligible for. Knowing what you're eligible for tells you what level you're at. So if it says you're eligible for 100, that means you're at 30. If it says you're eligible for 275, that means you're at 100. So, and then if you were already at maxed out and you're at 275, it'll show you, hey, if you want to track your patients, here's how you track them. So just putting that information in the system will tell you what level you're at.
Excellent. And then we had a question come in a private chat. let's see here. Do I have to wait 1 year before I can apply for a 100-patient waiver? I have a 30-patient waiver now, and I work with substance use disorder.
So, couple of questions. So somebody asked me to drop the link in again, so I'm going to drop the link in again. Okay, since there are a few questions on this, I'm going to put the eligibility criteria up on the screen one more time for you guys, and we're going to go through that again. So if you are a physician that holds a board certification, or you're a practitioner that provides medication-assisted treatment in a qualified setting. So what is a qualified setting? Provides professional coverage for a patient's medical emergencies during hours when the practice is closed. This means you have to have 24-hour on-call coverage for a patient in need if they're having issues. Provides case management, provides, let me make this bigger actually while I'm reading. Oh, see, this is why Dr. Lindsay wants us to practice everything 18 times because technical issues. Go back to the practice setting, and we just won't do that again. So you have to have case management. You have to have services such as medical, behavioral, social, housing, employment, education, etc. So you have to have really big wraparound case management services, as well as having an electronic health record system. And you have to be registered for the PDMP and use it. And you also have to accept third-party payments. So the two biggest barriers for the majority of people is that 24-hour on-call coverage for any issues and the wraparound case management services that have to be pretty robust. So those are the two biggest barriers. If you have all of that, then you meet the qualified practice setting, which means you can initially apply for a 100-level waiver. You don't have to spend any time at 30 at all. You can jump right into the 100 level. Now, your question was more complex than that because you stated, I've already spent a year at 30. Did you spend a year at an exempt 30? Meaning you applied for the exemption waiver because you didn't have training and you spent a year at the 30 exempt level? If you did, then unfortunately, that does not qualify you to move up. Any time spent under the exemption means it doesn't count towards that year that you need to move up to the next level. So the only way you can move up to the next level is be in that qualified setting, be board certified, or have the training, the 8 hours or the 8 and 16 hours, spend a year at that and then move up. So hopefully that answered your question. Any other questions?
Yes, I've not been able to send the form through, and I don't know why. I don't mind sharing my screen. And then I actually took this class, the 16 and 8-hour course, like 2021 or 2020, but I did not apply for it to be on my DEA license. However, I own a MAT program, but my supervising physician has been doing all the prescribing. And
Gotcha.
sometimes when he's not available, it's really hard for me because I don't know how to navigate around it. I don't know what level I should be by now.
Understood. So a couple of things. Number one, your training, if you do the 8-hour and or 16-hour waiver training, it never expires. Never, not once. So
Okay.
if you took it in 2020 and you don't apply for your X-Waiver until 2030, that's fine. You can use the same exact certificate to apply for it. The training never expires. Now, if you've lost your certificate, I don't know what your background is in, but for advanced nurse practitioners, if they've gone through the nursing website, do not restart it, because if you restart the training, it'll erase your old progress and your old certificate. So you need to email systems management and ask them for a copy of your certificate if you have lost it.
I have my certificate. I have both of them.
Okay, excellent. So you have your certificate. Having a certificate does not count towards the time. Only having your X number counts towards the year that you need to move up to 100. So if you never registered, you're still at entry level. Okay. So registering and having the license is what starts the clock for that. So before you share your screen, I want to address everybody else's questions. And then we can dismiss everybody, and then you can share your screen and we can try to troubleshoot. So are there any other questions out there? Is there a website to track how many patients the provider currently has? So 2 things, probably not. So one way that you can do it is look at your own electronic health record system. There are a lot of electronic health record systems where you can query, you can pull a report of how many active buprenorphine prescriptions that you have. So it may be a process of you contacting IT to figure out how many active prescriptions you have at a time. If you don't have that with your electronic health record systems, there are some providers who manually track it with an Excel spreadsheet, and they might have their MA do it or their nurse do it. And every time they write a prescription, the spreadsheet gets updated. But unfortunately, there's not like a central repository that you can find that out, just because there's too many different electronic prescribing systems and too many different pharmacies and too many cooks in the kitchen, if you will, for there to be a centrally located way to track that. So your electronic health record system or manually tracking it is probably the best ways to do it. Okay, so there's another question. Clarification to make sure I understand. So I need the training and then I can move up. Currently work in substance use disorder and have an exempt waiver for 30. So if you have an exempt waiver for 30, you will never be able to prescribe for more than 30 unless a new piece of law, a new piece of legislation comes out and changes the Controlled Substance Act, the Data 2000 Act, and the CARA Act and changes the wording. The Health and Human Services was only able to get an exemption for the entry level, meaning you don't have to have the training. But since training is actually in our legislation wording, you can't move up unless you get that training. So yes, one more time, you have to have the training if you want to prescribe to more than 30 people. Hopefully that clears that up. Okay. So I know it's so confusing. It's so confusing because so many people don't realize that these are actual laws. Like, we're having to jump through all these hoops and barriers because some lawmaker who has no medical background decided these arbitrary rules that we have to follow. So I feel your pain. I hope, and maybe everyone on this call can write their congressman and say, hey, can we get new legislation so we don't have to go through all this business anymore? I fully support you doing that. All right. Okay. Well, oh, great. Another question. Does Vivitrol require an X-Waiver? No, because Vivitrol, otherwise known as extended release injectable naltrexone, is not a controlled substance. So you can write for any non-controlled substances that you want for a substance use disorder, and you're not violating the Controlled Substance Act. It is just with controlled substances that there is this massive barrier. So if you need to write somebody for Zofran because they are having massive vomiting from their withdrawal symptoms, you can write for Zofran. You can write for naltrexone. You can write for anything that's non-controlled without an X-Waiver. You do not need an X-Waiver for that. It is only if you need to write for a controlled substance. Okay, do I have a step-by-step friendly use for new prescribers? You know what? I am going to encourage you to go to pcssnow.org. They have a ton of resources. If you cannot find what you need, join our Echo call. We have a ton of prescribers on there that can help walk you through anything that you need. And if you have a particularly difficult case, email Be Well Texas and say that you want to present a case during one of our Echo calls, and we will welcome you on a call to present a case. We won't share any patient information, HIPAA compliant, but we can discuss it in generic terms and help you through that. Oh, look, Dr. Lindsay putting in some
Yeah, I
links.
put the link for the PCSS resources in the chat. I just wanted to mention we're at time, so if anyone has to jump off, please feel free. But I know Dr. Walker's being generous with her time and said she can stick around for 10 or 15 more minutes if people have questions individually. But I just wanted to thank anyone that maybe needs to leave right away. We appreciate everyone being here. Be sure to get your information in the chat if you need continuing education credits, and otherwise we appreciate everyone's time, and we'll be around for a few more minutes for additional questions.